name is Allison Wilson, and I'm proud to be one of the founding members of Women of Wellness.
My name is Andrea Bendele, and I'm a founding member of the Women of Wellness.
Hi,
Hey.
Andrea. So good to see you. Nice
Absolutely.
to see your smile without a mask on.
Absolutely.
Although we're
So good to see you in person.
safely distanced in person.
Rather than Zooming.
Yeah. Well, I'm sad that we're not going to get to have a Women of Wellness banquet or luncheon this year. That has been so meaningful to me these past couple of years, and thank you for all the effort you put into helping start that. But I do want the community to be aware of how we've grown and what Women of Wellness is at this point. Can you tell us a little bit about that?
So Women of Wellness is a network of women in the community that have come together to get educational opportunities about Stillwater Medical and the resources that are available to them. It's a network that allows us to also come together and advocate for better medical care and services in our community.
I know that in my household anyway, I'm the last person that I look after from a health perspective. I'm always going to the doctor if my kids are sick or if I feel that they might be running a little too high of a fever, or if my husband's sick. I'm always worried about that, but I don't always stop and think about my health. And one thing I've really appreciated about Women of Wellness is it forces me to spend time thinking about that, discussing issues that are important to my health, because I know in my family, if I'm not healthy, our household is not running smoothly.
Absolutely, absolutely. And that was, I think, one great thing from the first luncheon that we had is it really did encourage the women to take some time for themselves and ask questions. We had an opportunity for people to text in questions, and they were asking questions that they might not otherwise would have asked. And it encouraged them to get better health care, I think, for sure. So the Women's Health Center is getting a new facelift and being improved. What does that mean to you as a woman who's had children in the Women's Health Center?
Yeah, so I've had two little girls in the Women's Health Unit at the hospital in the past 4 years. So I have a busy household. But modernizing the Women's Health Unit and the fact that the hospital is focusing money there means so much to me. I got to stay in Stillwater. I had a very traumatic second birth with a lot of medical complications. And in most communities, I would have had to leave and go to Oklahoma City or Tulsa to get the kind of medical care I needed, which would have taken me away from my newborn baby and my family during that really important time. And because the Stillwater Medical Center has invested into our maternal health unit and has the type of nurses and the number of doctors and the equipment, they've invested into that. Because of that, I did not have to leave Stillwater, and I was able to stay in the hospital here with my newborn. That was incredibly important to me and something most women around Oklahoma, if they'd been in that same situation, wouldn't have had the ability to do. The fact that this medical center is investing even more into the maternal health unit and making it a mecca for northern Oklahoma in child birthing is just incredible and a testament to how much our medical center cares about women's health and families.
Absolutely. And it's also will be an improvement for those who might not be of maternal age, childbearing age as well.
Right. At our last Women of Wellness event, we had an OBGYN at the Stillwater Women's Clinic come and talk about all of the things that women need to be thinking about from a gynecological perspective throughout their years. And it doesn't just end with childbirth. There are so many other factors to consider. There were 10, I think, things that were given to us as checkpoints that we needed to consider as we age. And so that maternal health unit, you're absolutely right, isn't just focused on child rearing or child birthing. It is so much more than that, and our medical center is investing into that whole span of women's health. I'm so excited about some of the ideas we have moving forward, specific perks for Women of Wellness members.
Yes, absolutely.
The cost associated with Women of Wellness is $300 for a year. That buys you into the bigger events, but it also allows you access to some more premium events for members. special learning events, tours of the Heart and Vascular Center.
Hopefully we'll be able to tour the Women's Center whenever it's completed and we could all get back out together in a group.
Right. It gives us more time with Denise, one-on-one time to ask questions. And it also allows us to continue to grow this program. And so we've increased our membership almost, I think, by 50% this past year. I'd have to get the exact numbers.
Great growth. We look forward to growing that number some more.
Right. So we encourage, I've been encouraging people to learn about Women of Wellness and become members. We do have a lot of exciting new ideas we're talking about. We have an app that we're starting with some discounts around the community that give you updates from the medical center, things that women and families need to know given the healthcare environment right now.
Yeah, absolutely. You know, one thing too, Allison, that I think we have a unique opportunity with the Women of Wellness is that we are able to connect with Denise, who's the CEO of Stillwater Medical. There's not very many companies that would allow their CEO to connect with our group the way that she does, and I think that's just awesome that she takes her time to do that.
Yeah, it's amazing. I think women are so in tune with their family's healthcare. To have a woman leading our medical community is just a really valuable asset to our community.
Absolutely.